Now, as the country marks National Child Protection Week, about 1 in 7 South African children have a treatable mental health condition. But most will carry the burden through to adulthood due to South Africa's lack of specialists and facilities to support their unique needs. That's according to psychiatrist Dr Alicia Porter, who's a board member of the South African Society of Psychiatrists. Dr Porter adds that the COVID-19 pandemic has worsened already failing public mental health care for the country's 22 million children and teens. She added that this put their ability to transition to a fulfilling and productive adulthood at risk. And to make the issue more concerning is that South Africa only has about 30 specialist child and adolescent psychiatrists who are mostly in private practice where access is limited by affordability. For more on this, we're now joined via Zoom by Dr Alicia Porter, who's a board member of the South African Society of Psychiatrists. Dr Porter, thanks very much indeed for joining us and welcome to the program.
Thanks for having me.
It's quite a concern what you're telling us. 1 in 7, that is a lot of children. Perhaps let's start with typically the kinds of mental health challenges that children will face that may go under the radar. Because when they're profound, I think you can pick up there's something wrong, but often we might just brush it off as saying that this child is hyperactive or this child is moody. I don't know.
Yeah, I mean, I think children are quite complex, and so oftentimes mental health conditions are missed in children. The most common conditions that are missed is anxiety, depression. We've seen an increase in post-traumatic stress. We've seen an increase in eating disorders. We've seen an increase in self-harm and also, suicidal thoughts and even suicide attempts. So we've had an all-round increase, but I think anxiety and depression are the two most common mental health conditions in children that are often missed. Like you say, hyperactivity is quite obvious, but anxiety and depression presents very differently in children than they do in adults, and that's probably why it's often missed, or it's put down to just a phase or children being naughty.
So what is anxiety? You know, again, I think maybe we watch too much television and then we get this idea of what it might be, but what does a child go through when we're dealing about anxiety? Because I'm sure some parents might think they're just nervous, but it's much more than that, isn't it?
Yes, I mean, with children, they find it difficult to articulate. So they might not be able to articulate that they feel anxious, but children would have an increase in things that worry them, for example. But it's also not the same things that necessarily worry adults. You know, commonly we'll hear children talk about worrying about something happening to them or their parents or something happening to their friends. So it's got to do with where they are from a mental point of view. So they may worry, excessively. It might be difficult to control this worry, but they then might present with symptoms like, for example, recurrent tummy aches or headaches. Or muscle tension. They may complain of or have sleep disturbances, which might often be, missed or not picked up by parents. They may struggle with irritability, so they might not necessarily have a depressed mood, but they might be irritable. And in younger children, that might look like tantrums or just not being compliant. So it looks quite different in children as opposed to to an adult.
And
that's where the difference.
Yeah, and I suppose that there's a lot that goes on in the world now. Before, the news was only on once at night at 8 o'clock, and chances are the kids were in bed. But now, 24 hours a day, they're hearing messages of someone's died of COVID, someone's been shot, someone's been killed. And I guess this must weigh in on children who don't have the life experience, vocabulary, and understanding of the things that are going on around them?
100%. And, there have been studies that have shown that now with the age of technology and access to the internet, there's been a significant increase in mental health concerns within the children and adolescent age group because, we haven't developed any more from an emotional or psychological point of view. The developmental trajectory is still the same, but what they are exposed to, and being exposed to the internet, social media, that has actually brought about things like cyberbullying. Also, I often tell my adolescent patients, once something is on the internet or once it's being posted on media, it can go viral. And things that may have been contained before, like pictures, it can go viral within a matter of seconds and it's there forever, And so these are some of the challenges, but there's definitely been an increase in the trend that's been directly related to access to social media and the internet.
Mental health, is this something that you're seeing right across the childhood to adolescent spectrum, or is there one group that you're finding is a little bit more vulnerable than others?
I definitely think that the adolescents are more vulnerable, but we are seeing an increase, in the ages of between 10 and 19 years old. There's been an increase, and I think this increase is globally. It's not just a South African phenomenon. It is across the globe, particularly post-COVID. And I think we sort of haven't appreciated the impact that COVID had on normal development, because with children and adolescents, it's often about development, where they are from a developmental point of view, what is developmentally appropriate, and there's been a complete disruption of that. And I think we haven't fully come to or been able to grasp the extent of the problems with children and adolescents. But on the ground, we're definitely seeing a significant exponential increase in the number of children and adolescents that are requiring help, that are requiring support.
If the interventions do not come whilst they're still young, is this stuff that's going to sit with them in adulthood?
100%. There is research that says that a lot of adult mental health conditions, if we go back, the average age of onset is about the age of 14. And so untreated mental health conditions in children and adolescents definitely leads to an increase in physical and mental health problems. It results in an increase in substance usage, but also it can have an impact on the economy because, the children and adolescents of today are the adults of tomorrow, and if there's mental health concerns, they definitely will be less able to contribute economically. They won't sort of achieve what they would have, and so that does then have a ripple effect in terms of the impact of untreated childhood and adolescent mental health problems.
And so we've got a double challenge in South Africa in that, A, we don't have enough facilities, but even if we build facilities, we don't have enough health practitioners in the mental health field to help the many people that require their help.
And I think that's where, we need to think, and I think that's where innovation and collaboration is going to be required, because while there's a shortage of specialists, within the child and adolescent space, definitely we need a multidisciplinary team. And if we can begin in terms of upskilling within primary healthcare, for example, and training within primary healthcare for where we start training, for example, nurses to identify mental health concerns in children and adolescents. So you'll have screening and early interventions or early detection, and also mental health awareness and primary prevention programs that may go a long way in assisting. But also even just looking at our schools and looking at school-based interventions, because children spend a lot of time at school. It's often teachers who interact with them the most. It's about how do we begin to upskill our teachers, for example, in how to recognize these mental health problems, how to, basic counseling skills, or even just incorporating mental health into the curriculum where we can teach children coping skills and begin to build resilience. I think that would go a long way in terms of assisting rather than waiting until the problem is dire and the condition is severe before seeking help. So I think definitely we need to be looking at our primary prevention measures and our early screening and early detection rather than waiting for, a complete manifestation of mental health.
We've run out of time, but maybe one last question. And I'm glad you mentioned the schools, because I was thinking that, perhaps in an ideal world, there should be a child psychologist in every school, and that maybe we need to make sure that mental health gets put up a little bit higher in the terms of list of urgent conditions that need to be looked at, because I get a sense sometimes that mental health is not treated as seriously as somebody who comes into a clinic with a broken arm or something.
100%, but it is also the World Health Organization that says that there's no health without mental health. And so I do think we need to begin to prioritize, we need to have a greater investment within mental health. And at the moment, it really feels like on the ground, like on a daily basis, I literally take a knife to a gunfight. And the problem is overwhelming on a good day. And so there needs to be, like I said, innovation, and we need to begin to collaborate, because I do think that this has an impact, ultimately even on our economy, because if we don't have a healthy next generation, we're going to be in trouble.
Dr. Porter, thank you so much indeed for joining us. Keep up the good fight. I know that it feels like you're climbing hills all the time, but we appreciate your work. Thank you so much.